Hello and welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and give you the tools to take control of your healing journey. If you're living with persistent concussion symptoms, we see you. We know the frustration, the confusion, and the feeling of being stuck in a world that just doesn't understand. This podcast is here to hopefully change that. Each episode, we dive into real questions from real members of the Concussion Fix program, an online recovery program that has helped over 3,000 people find clarity and relief since we launched in 2020. With an average symptom reduction of nearly 50% within the first 2 to 3 weeks of joining, the Concussion Fix has empowered thousands to reclaim their lives. And if you need a little extra help on your journey, we invite you to check out the Concussion Fix program. In every session, you'll hear from our expert team. Myself, Dr. Cameron Marshall, founder of Complete Concussions and a leading concussion researcher with over a dozen peer-reviewed publications. You'll also hear from Dr. Paul Herkel, a naturopathic doctor specializing in concussion recovery, chronic pain, and neuroinflammatory conditions. And you'll also hear from Melinda Crinan-Hill, a psychotherapist focused on mindfulness, chronic pain, and concussion care. These episodes are recordings from our live interactive Q&A sessions with real Concussion Fix members, where no question is too small and every story matters. To protect the privacy of participants, all names and personal details have been kept confidential. Now, before we dive in, please remember that the information shared in this podcast is for educational purposes only. It's not intended to replace personalized medical advice. We encourage you to consult with your healthcare provider for guidance specific to your case. So, whether you're looking for answers, hope, or just a little encouragement, we're here for you. You are not alone. Recovery is possible, and it starts right here.
Please note that the audio quality may vary at times due to factors such as members' microphone limitation, but we appreciate your understanding and hope you enjoyed the valuable insights shared throughout the podcast.
Hi, good morning.
Good morning.
I have a very quick question first. Dr. Herkel, I had posted on the I don't know, the news feed or how, I don't know what that's called, but on the wall, the Dutch, I'm about to order the Dutch thing that you had sent. The one that you sent, I believe, has cortisol awakening response and also insomnia cortisol something. And that's not what my doctor had ordered. Do you think I need specific things additional?
So sorry. It looks like you're kind of not talking into your microphone. That was clear for a couple seconds, and it's kind of muffled. I don't know if it's possible.
Okay, is that better?
A little bit better. You're asking, the type of Dutch testing that we discussed, I think, a couple weeks ago. Is that right?
Yeah. So she had called in the one, you sent the plus one, which includes the cortisol awakening response and then also insomnia cortisol. Those are the only two additional things that I think weren't included on the one my naturopathic doctor sent. Do you think I need those two things?
Well, I think that's ultimately it's up to your naturopath to decide which one is best. I think you're comparing the Dutch Plus
Yes.
to the Dutch Complete.
Correct.
Is okay, yeah. So the Dutch Complete I probably run 90% of the time. The Dutch Plus is a little bit more expensive, but it does have a number of additional points. One of the main things is that it has the addition of a saliva hormone. It's actually going to be tested multiple times in the morning at more frequent times. Normally with the Dutch Complete, it tests you in the morning and then 2 hours after waking. With the saliva hormone, you're actually testing every 30 minutes for those 2 hours. So you have a little bit more of an accurate response of what's happening with cortisol in the morning, because there's a body of evidence showing that morning cortisol awakening response is really important to determine overall cortisol function in the body, inflammation, etc. So you're basically just missing out on that if you don't do the plus. So I guess that if your naturopath is going to get the information that you need, you're still going to get a cortisol morning 2 samples to look at. You're just not going to
Okay.
have maybe the detail and the nuance of the plus with the additional saliva testing. And I guess part of that also is to assess for insomnia. So there's a sample overnight. The Dutch Complete does have also an overnight sample, so you are still going to get that covered.
Okay, so you still do get the cortisol awakening response. It's just not as, I guess,
It's not as detailed, I guess,
comprehensive.
would probably be the
Right.
best way to put it.
Okay. And if you were my naturopathic doctor, what would you say, get it or not get
That's such a loaded question.
it?
I have to defer to what your ND is going to say is best
Okay.
for you.
Okay. Yeah. So my initial concussion was in February 2 years ago, and I felt like I was recovering, doing fine. In October of last year, I got a craniosacral treatment. Are you guys? And this may also be a question for um, someone else. I don't know. But are you guys familiar with a craniosacral treatment?
We are.
Okay, that somehow re-triggered my concussion. It felt like my brain was washing back and forth in an ocean, and I know that's not like physically possible. But I spiraled very, very, very far down after that. Started immediately after, had all the sensitivity to light, um, started having panic attacks after that, like to a degree that was never experienced with my initial first concussion of just hitting my head. Can someone explain what happens during a craniosacral and why that? Because no neurologist, no anybody who ever really was able to even piece those two things together. I just said, hey, I'm really bad after this craniosacral treatment, and everybody's like, maybe coincidence. I don't know. No one really was able to explain it. Can you explain what happens during that and why that would have re-triggered it?
Yeah, sure. It's not specific to craniosacral, so I want to make sure we kind of cover that idea. But
Okay.
if, like, for example, this happens all the time in people that have neck dysfunction, I treat their neck and it flares their symptoms. That's just a sign that your neck is involved. Neck dysfunction and these kind of like biomechanical issues that people have, these postural strains and whatever else, those symptoms, like the symptoms of neck dysfunction, are identical to those of concussion. So if you have a neck issue, it will cause your autonomic nervous system to go haywire. If you have neck dysfunction, it will cause headaches, it will cause dizziness, it will cause visual impairments, it will cause every single symptom you could attribute to concussion, but it's actually just from your neck. So when people get treatment, manual therapy treatment of some kind, whether it's craniosacral, whether it's adjustments, whether it's soft tissue, whether it's massage, sometimes that just activates issues in your neck and basically causes you to have, these symptom flares. Now, most people respond by saying like, "Oh, I'm never doing that again because that flared my symptoms." But in reality, that's actually a good sign because it shows you that something's there. Something needs to be worked on there. And the idea is actually you need probably more of that because that obviously showed you there was some dysfunction there. Now, whether it's
Right.
craniosacral or not, I don't know. It could be something, you might want to get
They
a
barely touched my head. I mean, I'm talking barely, barely, barely touched
yeah.
my actual head. They didn't massage my neck. They didn't.
Again, this has nothing to do with your head, right? But if you change the biomechanics at the low back and the sacrum, that alters your posture all the way up, which then can cause your neck to trigger, right? So
Okay.
it's kind of it's all that. Like usually these situations are due to neck dysfunction, and if you change something in the chain, your neck is gonna have to kind of coordinate that. So it could have been that. The other thing that can happen is sometimes if you're already in a dysregulated state, manual therapy or touch can actually just cause that to flare more. So it may be that your autonomic system was just a little bit on edge and flared up prior to, and that just caused it to go more haywire. Those are kind of the leading, thoughts around it.
Okay, great.
Yeah, but generally I wouldn't be afraid of like craniosacral because it's not going to do anything to your concussion, right? You said, "Oh, it caused my concussion to come back." Well, no, it didn't, because the concussion is healed. It's already gone. You're dealing with
Uh-huh.
the other systematic issues
Symptom.
that are
Yeah.
happening, right? So what happened? Well, it may have triggered an autonomic response. It may have altered your biomechanics that made some neck dysfunction flare. But either way, it's a sign that, okay, I need to start working on bringing my autonomic nervous system down. If I'm going to get any treatment, I want to make sure I have that. If I'm anxious about treatment, I want to make sure I'm working on Melinda strategies to be able to
Right.
calm myself down before, during, and after. But also, it's a sign that maybe I do have some more neck dysfunction than I originally thought, and maybe I need more work on my neck, not less.
For sure, I know I have neck dysfunction. I'm not to that module yet, and I haven't had any kind of manipulation or any kind of chiropractic or anything. And I know that that's an issue for sure. I know that that's an issue. I'm just
Yeah,
not there
that's
in the
fine.
modules yet. Yeah.
Yeah, that's fine. Don't rush into it because, like I said, if it is an autonomic response, you want to make sure you're doing all the preliminary steps now to make sure that you have the, kind of the mental health anxiety tools in place so that
Right.
when you
And
do
that's an
go,
issue as well.
and
Yeah.
make sure your autonomic nervous system balance, make sure your inflammation is low, because then when you go, you're going to get way more benefit out of it, and you're not going to have this major spiral out of control because you have the tools in place to be able to kind of counteract that.
Right. Right. Okay, great.
Right.
Thank you.
I
You're
think it
welcome.
really speaks to how much emphasis, everyone who's been through this puts on those symptom flares, and just continuing to reflect on when I get those symptom flares after A, B, or C treatment, what's really happening for me. Because when we get so overwhelmed by the symptom flares, my concussion's back, I can never go back to that kind of treatment again, or am I going to be worse moving forward, right? These kind of spiraling thoughts can generate that autonomic response, that sympathetic activation, which can link to things like you shared with us, like panic attacks, at a more extreme version, right? We're so overwhelmed that our body goes into a state of panic. So there's so much emphasis we place in the program on how you respond to these symptom flares. And that's all covered in that recovery mindset section, because if we're anxious, if we're gripping, if we're tight, if we're so overwhelmed and worried about the symptoms returning, then things spiral from there. It dysregulates an already dysregulated nervous system, if that makes sense. And things get worse from there. So that first piece to really hone in on is, what's my mindset when I get a symptom flare? Do I freak out? Well, it's natural to freak out. It's natural to get overwhelmed. It's natural to get anxious. But if I'm doing that, then where's my nervous system when I'm trying to go back to these treatments and have them be effective for me? Because the more anxious and nervous we are, the less likely those treatments are to be effective, because we're going in with this already fight or flight response in the body. We're holding tension. We're unlikely to be in a state where we're receptive to the treatment. So kind of that's always that first line, is really understanding what might be happening at that autonomic system level and from that nervous system response. And then moving into what Dr. Cam was sharing with you, this idea of, well, it's likely still neck dysfunction. That's
Right.
why symptoms are flaring. But before you might be receptive to treatments that are going to support your neck, you first need to feel safe having the treatment.
Right. Thank you for that. That's very true. And I think at the time, I I was so anxious because I had no idea what was actually happening to me. Because again, I didn't have symptom flares. I thought my concussion was 8 months prior. I thought it was all over. I didn't know what was even happening. I think that's where a lot of the anxiety came from, and neither did any of the doctors.
Right.
So
Absolutely.
I, it was like, I kept going to the hospital. I'd never had a panic attack in my life, and all of a sudden I was completely not functioning, and no one had any idea why.
Right,
Mhm.
which amplifies it for
They
you.
were looking for a
Like,
gas leak in our house and found, what I'm saying? Like, it was so off
Yeah, yeah.
topic that I just didn't even, it took months and months and months to even connect the dots of what was happening, and then, find this program find a naturopathic doctor. But for so long, it was so unknown.
Yeah.
Yeah, that speaks to the gap in the system as well, right? If we can't lean on a provider that's able to explain it for us, then we continue to spiral with our mindset and with our mental health because it's scary having these experiences without the proper support.
Yeah, it was very distressing, and no one could tell me
Worse.
why or how to get better. Yeah. So,
Yeah.
but you're spot on. Now that I know those tools, being able to call on them when I need them. You know. Thank you guys very much.
Welcome. That's just, I want to bring up one more thing just because Melinda kind of reminded me of it when she said it. But one of the reasons why we put the mindset module first is because you can't learn how to do those skills when you're in a state of spiral, right? So if something happens and you start to spiral, if you haven't developed those skills, you're not going to be able to call upon them in that time. And that's not the right time to try and learn how to do them because it's not going to be effective. So one of the reasons we put mindset first and really get people to try and do that and build those skills is because we know throughout this program and throughout concussion recovery, you're going to have things that flare your symptoms because part of concussion recovery and rehab is actually pushing into things that make you symptomatic. Now, if you don't have the tools built up and you haven't really taken Melinda's module seriously at the start and you haven't done the work, what's going to happen is when those symptom flares happen, you're going to turn something that would have been a 24-hour setback into a 3-week setback because you didn't have the tools, because it's not the inciting incident that causes necessarily the setback. It's your emotional response
Right.
to it. And so once people start to panic and freak out, then it's like a spiral out because now that just activates your nervous system more and more and more, and it just keeps going down and down. You start panicking more and more and more, and it goes down and down. Your sleep suffers, your inflammation, your gut starts to be like all these things start to happen. So that's why we really hone in on people, even if they don't feel that anxiety is a component of their concussion, because a lot of people think, that's not me, and I'm just going to skip past this. But what's going to happen is that when something triggers you, how are you going to respond to it? Because we know there's going to be setbacks along the way, but having a really good skill set in terms of the mindset modules that Melinda talks about is going to really prevent that 3-week setback, right? That's going to really allow you to be like, nope, here I am. I'm going to do my grounding. I'm going to do my breathing. I'm going to bring myself back. And now all of a sudden it's like 2 days later, you're just right back up and moving along, right? So that's why we try to get people to really take that part seriously. So I just wanted to kind of say that.
Thank
Anyway.
you. Thank you guys.
Okay.
Hi. Yeah, just wondering, it's been a while since I've been on the questions, but the one time I was hoping to get on, but I just heard you, Cameron, go through like AI kind of diagnosis about if there's a certain, like something that I'm missing. Like I've been on it since July and I was working on my diet and my mindfulness and stuff like that, but my story was about like 20 years ago. I first had my concussion. I know I don't have a concussion, but I have the still the symptoms from like the my memory and my neck getting dizzy. So like the dizziness or the eyes, so not knowing like yeah those exercises or which ones I need to focus on more. So, do you understand what I'm saying? Like the one time you had one guy on and you had a list of questions that you had like and you said like an AI kind of diagnosis about what kind of area that he should be kind of focusing on.
He's referring to the symptom bucket that you do at CCMI.
Right. Is that what you want me to do?
Yeah, is there time to do that now, or just...
Hold on. Let me log in here.
It's not quite yet based on AI, but we may get there at some point.
Yeah,
Just based
okay.
on the evidence and kind of our clinical input.
Well, it's based on our data, but hold on. Let me
While he's looking at that, are you tracking your symptoms in the app to see kind of where they're at?
No, I haven't done.
Okay. Because that sometimes I find I wish I would have had it when I was going through the program, because then I could kind of see which ones were worse certain day, like where it was referring back to, what did I do the day before, things like that. Um, I just found that an interesting way also.
All right. In the past couple days, how would you rate your headache? 0 to 6?
Sorry, 3.
3?
Yeah.
Pressure in the head?
Yeah, 3.
Neck pain?
2.
Nauseousness?
0.
Dizziness?
1.
Blurred vision?
Yeah, like I was off and on. So, but 1, I guess 1,
Balance problems?
2.5, 2.
2. Sensitivity to light?
0.
Sensitivity to noise?
2.
Feeling slowed down?
Yeah, 3.
Not or fogginess?
Fogginess. 3. 3.
Not feeling right or not feeling like yourself?
Yeah, 3.
Difficulty concentrating?
2.
Difficulty remembering?
3.
Fatigue or low energy?
3.
Confusion?
1.
Drowsiness?
Yeah, 3.
Trouble falling asleep?
0.
More emotional?
2.
Irritable?
3.
Sadness?
2.
Nervous or anxious?
2.
All right. Any bets? Paul, Melinda, Nikki, you have any bets as to what it's going to show?
I have a pretty good idea. I'm gonna wait till it shows it.
Ah, scared to lay it out, eh?
Oh, it's gonna say. I think it's gonna say more psych.
Psych is 3. So inflammatory gut hormones, neck, psych, mental health, autonomic, but they're all pretty high, right?
Pretty equal across the board, to be honest. Like
Visual and vestibular is low, but like everything else, like 2.2, 2.15, 1.97, like all 4 of these are pretty much there. So you've been in the program since when?
July.
July? Where are you in it?
So yeah, like I worked through like the I haven't been doing as many hours now as I could have. That's part of it. I have to. At the beginning, I've gotten to like the. I'm just looking up here now. The more towards the end of the dizziness and the dysfunctional, but I haven't been consistent on those. I was working on my diet and the other parts, but yeah, I have some of the other exercise I've done too.
So I would stop there. Like I wouldn't even bother going much further forward, but I would go back and go back to Melinda's section, Paul's section, kind of redo that whole point because you got inflammation, neck, mental health, and autonomic that are all there.
Yeah.
And aside from neck, like I wouldn't worry about visual and vestibular exercises. That's really low for you. So it's really the foundational stuff that needs to be kind of reined in. So um and maybe get some neck treatment. Like if you have a good manual therapist that can help you with that, that would be my recommendation is just to go back and redo those components because your biggest issues are in the foundation.
Okay.
Cam, for our listeners and members here, could you maybe explain what this tool is for people who haven't seen it?
So this is our clinical software that we have at Complete Concussions. So this is something that we built about 10 years ago, and it's used by all 450 of our clinic locations. So it's the largest concussion data set in the world. It's the largest EMR system for concussion, and so this is basically like a symptom bucketer based on your symptom profile to be able to say these are the top causes, just to help clinicians make better decisions as to how they're going to go with treatment. Obviously, it's a patient education tool as well, right? So we go through that, we see it, and then we can give some areas of focus, especially if somebody's kind of unsure of where to go next. But in this case, it's go back to the start. Like,
Yeah.
there's still a lot of foundational issues that are kind of driving a lot of this.
Like when I do this very similar questionnaire with my patients in my practice, actually just on paper. It's the post concussion symptom questionnaire that's been
It's the
validated.
same one that's in our app too. Like if you
Yeah.
go to the Concussion Fix app, we have it there. Do your symptoms on a regular basis to kind of track how you're.
Yeah. What we don't do in the app is actually assign the buckets,
No.
right? We don't and at some point we will look at doing that, but we want to actually collect a little bit more data on the Concussion Fix members and create and roll it out, I think, in a more usable way. We also don't have to be careful. We don't want to put a diagnosis to anybody, or at least be anywhere close to even suggesting that. So ultimately, it's up to your clinician looking at your symptoms should ideally try to, in their mind, create and put you in this bucket, kind of create this checklist. But I agree with, based on my clinical experience, 100% with what Dr. Marshall said, is that you're kind of pretty even across the board, where you're probably going to have to do some work on each one of the levels. And when a person presents like that, we kind of say, okay, make sure that all the foundations are present. Have you gone through the course? Have you implemented each area of the course diligently and completely? But neck, diet, and working on the psychology would be the three kind of like top things that type of score would show me, because things like you have quite high on things like memory and concentration, and there's confusion, so there's a lot there, but that's kind of cognitive dysfunction, and cognitive dysfunction has a lot to do with psychology and the emotional side of things. So when I see majority of symptoms in that area, that makes me think that that's a really important place to start. So that would be just my kind of clinical experience.
And it's probably picking up the inflammatory component too, because cognitive issues can be related to that as well. So that's probably why. But I think it's a combination of those areas. So just kind of go back, start again, be really diligent on each component. Make sure you're being like 100% on diet when you get there. Are you exercising regularly?
But I'm at a gym twice a week now. I just started with that, and I get my headache goes up from it, but then it comes back.
Yeah, well, you should be staying below symptom threshold, right? And it should be steady state cardio, and it should be every day, not twice a week, every day.
Mm-hmm. Yeah.
Right?
Yeah, I bike every day, but then I do the...
Do you get symptomatic off your biking?
No, it doesn't affect me at all, biking.
Okay, good.
Interesting. Okay, well, that's neck probably if he's bouncing around.
Use that jumping, then my head goes up. But
yeah, that's probably the neck. That's probably the neck side of that.
Mm-hmm.
I have hormonal issues, like my hormonal stuff is really out of whack.
Yeah.
Okay. Well.
Okay. Well, that's
action items right there. Go for it. Yeah, get after it.
Okay. Thanks.
All right.
Okay.
We'll see ya. Let's do this. Let's do this in 3 months. We'll do it again. Come back and share with us. That's amazing. Thank you.
Hi. So I had my accident about 3.5 years ago. For the first 6 months, along with many other issues, my sound sensitivity was horrendous. Like I couldn't go out to a restaurant or anything like that. It was all sorted, I thought. And then at Christmas, I was on a dog walk with someone singing Christmas carols, and I started to get more and more tired and then had like a energy crash, balance started to go and things like that. Went and had a nap afterwards, was all fine. I was speaking to my vestibular therapist, and he recommended doing if you sit on a spinny chair, close your eyes and listen to different like music and things like that for 5 minutes. I did that the other day, and after 5 minutes, I was absolutely shattered. It looked like I was 10 pints deep with how bad my balance was. So I know that, like, I think the process is going to be continued exposure to that. But I suppose what is it that was the reason for that happening? Because I thought it was all fixed and hadn't had any problems for 3 years now. to suddenly come back so quickly.
Were there any other factors at this time where you had this flare that, for example, what I mean is, were you ill at all a week before? Was there anything different? Were you maybe dehydrated, a viral infection, a little more of a stressor on an emotional level, anything else like that?
No, absolutely. No, nothing from that. I did have a similar crash at a concert like 3 weeks before, where with like operatic music in a church with very good acoustics, that absolutely killed me.
Okay.
But other than that, I can't think of any other sound sensitivity crashes that I'd have. I get crashes regularly, a lot less regularly than I used to now, but still get them occasionally.
Is it only sound that triggers the crashes?
No, I think I get it from. I've been getting a lot of like neck rehab done, and that caused quite a lot of stuff. But yeah, I say the crashes are not that regular now anymore, which is nice. Shows it's all working.
And was there a time of the day that this happened, like this opera thing, and then this most recent episode?
First one was morning, and the second one was in the evening, same day.
Okay, so not really related to, let's say, having meal timing or alcohol consumption or anything like that.
No, not at all. No alcohol.
Yeah, I mean, I don't know, Cam. What do you think? There seems to be obviously some sort of threshold that you're hitting that's clearly there. I mean, I don't know. Do you have any residual neck issues that still need to be worked on now?
My neck. I think my cardio said my neck's pretty much there. I'm still doing some stuff to it. My back is started to hurt after my neck stopped hurting. So yeah, I know I'm like still not fully there. And continuing with that at work to get the neck back to normal. I just thought it was weird that the sound suddenly returned after so long.
Well, sometimes sound is a like a psychological stressor response as well. You could think about, we talk in the program about this window of tolerance. And when we're inside our window of tolerance, this means we're sort of smooth sailing. So if there's something disruptive in our environment, if there's added stress and we remain inside of our window of tolerance, we're sort of just smooth sailing through it. It seems to be okay. We don't get symptom flares. However, if something in our environment like loud sounds or a concert sends us outside of our window of tolerance, we get bumped out. What that means is our sympathetic nervous system gets activated. We start to go into fight or flight response. And this can become a pattern, like a neuroplastic pattern in the brain where you start to respond by having a symptom flare with loud sounds. So you can think of whether or not that fits for you. Sometimes these are considered sort of more psychological triggers that can generate symptom flares, and they are common. It does happen. If you remember the window of tolerance model from the recovery mindset, you can review that and see if it resonates. One thing I could recommend is that if you can anticipate being in a loud environment, see if you can work on some grounding strategies first. Make sure that you are equipped with something to help support your nervous system if you do anticipate being in a loud environment. And that could be like a testing place, right? Hey, is this a psychological trigger that might cause me to get bumped outside of my window of tolerance and generate these kind of symptom flares? In my experience, that is quite common with folks who have PCS, and that could be sort of that foundational piece. Hey, is this part of the picture? If not, okay, then move on to neck dysfunction or other types of issues that might also cause this response.
Cool. Thank you very much.
Yeah, I mean, the other things that it could be, I mean, like, kind of on that vein is like an autonomic, dysregulation. You've gone outside your window of tolerance. You have a sympathetic drive. Sound sensitivity is also associated with neck dysfunction, and it's also associated with dizziness. So if you're sitting on a spinning chair and doing any type of spinning, the reason why you look drunk after is because your neck really tells you about where you are in space. And if you have neck dysfunction, it's going to tell you that you're not in the right place and you're going to feel dizzy and off balance. So you said you've been working with the physio for your neck. Are they doing manual therapy or are they giving you exercises?
So it's a chiropractor. It's both manual and then exercises.
Okay. I would cut the exercises out,
Okay.
just manual therapy at the start.
So
'Cause
I'm 3 months into that now.
okay.
So
But it sounds like you still have quite a bit of neck dysfunction.
okay.
I don't know. I mean, just like, were you spinning on the chair when you were listening to the music?
Yes. Yeah. So that was, I suppose, very intentionally trying to trigger the thing. Interestingly, the when I did it 2 days later, the like I had significantly reduced effect. So I think like continued doing it will be, I suppose, reduce my sensitivity to it and
Yeah,
hopefully fix the issue.
it's exposure, right? It's exposure
Yeah.
therapy, kind of graded. The other thing you could see is it the sound or is it the spin? Because you could also just
Mm.
put noise canceling headphones on with zero sound and do the same thing and see, oh yeah, that still triggers me. Then the sound has really nothing to do with it, right? Going to the concert, is it the sound or the fact that if you have neck issues, you're going to have visual motion issues and all sorts of things. You're in crowded, busy environments. Is it that? Right.
Mm.
So
Yeah.
we have to try and isolate variables. And when you're doing the spinning, putting the sound on and all these things, right? You're out walking on Christmas, someone's singing, Christmas carols, whatever. Is it the walking and the motion or is it the noise? Right? So if you were just to be lying in bed with noise canceling headphones on, would that trigger it or no? Is it the motion combined with? You know what I mean? So try to isolate those variables and get a little bit more accurate idea of what the trigger actually is.
Mm-hmm.
And then I think that'll help you to kind of go forward. But I agree that if you're doing that, you're going to kind of desensitize yourself to that issue, and that's going to improve it. Like anything with concussion is like whatever makes you symptomatic, you want to push into a little bit. You don't want to overdo it because then you have a setback and then it makes it worse. But you really want to kind of walk that line of like, I know that my window of tolerance ends here. I'm gonna push just before it, and then I'm gonna pull back. And then every couple weeks, I'm gonna challenge that window to see has it moved, right? Has my line, my threshold moved? And then if so, then I pull back slightly from that and I stay within that window for the next couple weeks, and then I challenge it again.
Awesome. Thank you very much.
You're welcome.
You'll have lots of experiments to run over the next little bit now.
All right, I think we're gonna take one from the chat.
I was gonna say, there is one where just inquiring about a lot of the studies when it comes to G-force and concussion is done on young male athletes. You've talked about how the G-force is between 70 and 120 G. Just wondering if this changes for athletic, because all the studies are done on young athletic men. What about non-athletic, middle-aged, and older women? Does that change anything?
No, not that we know. The studies are done on young athletes because to put a helmet sensor on is an easy thing to do. To put a mouthguard sensor on is an easy thing to do. We can't necessarily put a sensor on every single lady's head walking around to try and figure out what the G-forces are of a slip and fall. But generally, just because they're young and athletic, the brain inside the skull is still going to have to get stretched to a certain degree in order to cause the neurometabolic cascade of concussion, right? So if there's a slip and fall and your head hits pavement or something, that's going to be a pretty strong acceleration force. If you're in an MVA, you're in a motor vehicle accident, your head hits the window or the headrest or the steering wheel, that's likely going to be a pretty substantial force. But we also have to consider that the symptoms of concussion are not specific to concussion. Meaning that if you have a slip and fall and you don't even hit your head, but you have this jerking of your neck, you may not have a concussion, you may have a whiplash injury, but the symptoms are going to be the exact same. So if you go to see any doctor, they're going to be like, oh, you've had a concussion, right? So we always will treat concussion and whiplash simultaneously because the overlap in the symptoms, we don't know what it is, right? If you come see me and you're like, well, I don't know if it's whiplash or I don't know if it's concussion, I don't know either. The symptoms are the exact same. There's no way for me to definitively tell you one way or another, but let's treat it like both. And if we treat it like both, we can't go wrong, right? So it doesn't really matter what the forces are. I wouldn't be too hung up on that, but we do have to realize that the forces to actually cause the brain to stretch are fairly substantial, right? Like this will not cause a concussion. It's just not enough force, right? But a smaller force can cause whiplash. Whiplash threshold is much, much, much lower than concussion. Whiplash threshold is 4.5 Gs, right? A good sneeze could cause neck strain and cause all sorts of concussion-like symptoms, right? So some of these concussions from these lower forces are not likely concussions. They're likely other factors, right? Or the other thing we talk about is the concussion cliff, right? Because dysregulation of your autonomic nervous system will cause the same type of symptoms as concussion. So if you're in a really high stressful state and then something happens, some minor perturbation, that can just cause your nervous system to dysregulate further and cause the same symptoms as concussion. So as we age, as we have these life stressors and things like that, if we're not addressing it, like we have maybe chronic inflammation, chronic gut problems, any little perturbation can kind of flare that up and then cause very similar symptoms to concussion. So I think it's more that personally. Now, again, I don't have the evidence to go off because we haven't put sensors on every single person just walking around in life, because it would take us years and years to actually witness a concussion injury. You know, if we were to grab 100 people that don't play contact sports and just gave them sensors to walk around with, it would take us a very long time to even see 10 concussions. So that's why it's not done in research. It's just too time consuming. No one's going to do that study. But in athletes, they're subjecting themselves to contact every day. It's easy for us to put a sensor on them, and then we're going to see concussions out of that. So then from there, we can gather what that threshold likely is. Now, the only difference I've seen is that in young children, the threshold is lower. In children around 11 years old, the threshold is actually between 30 and 60 Gs, or 30 and 90 Gs. So it is potentially lower in younger kids, but that may have to do with myelination. The other issue is that athletes are going to have stronger neck stability. So they're going to suffer less G forces with bigger hits. Whereas as you age, if you don't have good neck stability, a smaller hit could cause a more rapid acceleration than you would see, in a football tackle or something like that.
I also think that the question here is talking about the difference between just generally males and females, right? So he's talking about middle-aged women, but you could probably extrapolate, a college-age woman versus a college-age male. Yes, they're both athletes, so it's not exactly the same, but we have talked about the differences between males and females, and a lot of them have to do with, neck strength, hormones, other factors like that. So I agree. In my practice, I do see more females than males. What do you know about the data, Cam, on that in terms of the difference between males and females at any age?
I haven't seen much in terms of like G forces, females to males, but we do know that females get more concussions than males, but we're not entirely sure why. Like if you take sex equivalent sports like soccer, basketball, where the rules are the same, even rugby, women are 2.5 times more likely to get a concussion playing those sports than men are playing the exact same sport with the same amount of contact. So the question is, okay, is this a hormone difference, right? Is this a neck to head ratio difference, right? Like females tend to have smaller, thinner necks, but similar size heads. And so if you have, the same size head on a smaller neck, there's going to be more chance for whipping and motion. There's also a reporting bias that's been suggested. However, a couple studies have disproven that, where females may be more likely to report their injury or tell somebody, which then just creates a reporting bias where it looks like females are getting more concussions, but they're just reporting them more. But other studies have looked at that and found that female athletes were just as likely as male athletes to report, and in some cases less likely than male athletes to report. So that may not explain it. There's all sorts of different potential possibilities as to why this happens. There was a study that I just read yesterday, actually. It was a systematic review looking at males versus females and their rates of like depression after concussion, and it's much, much, much higher than males. And so I think that the mental health piece has to play into that as well, especially with persistent symptoms. But anyway, these are all these questions that we don't yet have answers for.
They're still theories. This is not definitive. And I think
Yeah.
that's kind of the takeaway. But I think you're observing just something that we also observe in practice, is that there is more females than males that seem to be having persistent symptoms. the evidence does kind of flesh that out, and we're trying to unpack why that's the case, but we don't 100% know right now.
Like, even if you look at my followers, like on Instagram, for
Yeah,
example,
me
it's
too.
80 to 85% are women,
Yeah.
right? And is that women that are actually interested in learning and hearing solutions, or, you know, versus men, or is that actually kind of representative of what the PCS sample looks like? Not sure. I mean, if you look at the majority of people in this program, it's majority women as well.
They just like your voice, Cam. That's all. Good question, though. I'm glad we brought that up. We actually just went back and took a look at, for the last 4 and a bit years, our most popular seminars, and that concussion in women, I did one, Dr. Cam did one, is by far our most popular seminar that we've done. So Nikki linked it. Go back and check it out. Lots of great information. We're going to be updating that in the new re-record course coming up later this year.
Great. Do we want to do one more in the chat before
Sure.
going live? Okay. So I've been seeing someone for chiropractor and concussion. It was going great. Last week, they ended by doing a side adjustment that felt a little off. I should have said something, but once I got up and realized he was talking to his next patient in the waiting room. By the next night, I could barely walk or sit. I went Monday and they put TENS pads for pain and it felt better. And I was able to walk again, but by that night, I could barely walk or sit. He said that he thinks due to the car accident trauma, my ligaments were stretched, and even with the clamshells and bridges, it wasn't strong enough. So he said no side adjustments for a month or so. Now I'm now I'm in excruciating pain and again with some headaches and nausea, but not from head. Anyways, can't do 30 minutes of or cardio since can't walk. Would you find a new practitioner, or is this just a misstep as you are progressing? Now I'm fearful of treatments and walking and sitting. Very frustrated.
Was this side adjustment, was this a low back adjustment?
They didn't say.
'Cause
Yes, it was a low back adjustment.
yeah, so I mean, if it's a low back issue, like, I mean, there's all sorts of potential things. It could be, you know, some hip dysfunction. It could be a pelvic thing. There could be, you know, some stability issues in the low back, and it's hard for me to say without taking a look at you myself. Um, it might just be a one-off. It's hard to say, um, you know, what the right strategy is in your particular case, unfortunately.
They also said
So
they can't do neck due to eye issues.
can't do neck due to eye issues?
Yeah.
I don't know what that means. If you have eye issues, there's a good chance your neck is involved, so you'd want to do neck if you have eye issues.
So
So
this is a lumbar adjustment, like a low back adjustment that triggered all these symptoms. Is that right, Nikki? From what the questions say?
That's what I'm assuming, yes. Yes, lumbar adjustment, and then they say they were I'm assuming that's falling over doing figure eights.
yeah, I mean, figure eights, it could be vestibular, it could be neck, it could be visual. Lumbar adjustment, basically, if you adjust the lumbar spine, it's going to affect everything up the segment and up the chain. A lot of times I see people that have like these pelvic obliquities where it actually makes one leg longer than the other. And so, you know, your body can kind of get used to that after a while, and it has this set point. And once you change that set point, it kind of causes some temporary kind of flares and tightness up the chain. And once you just keep working at it, and that eventually kind of, you know, levels out.
One
So
leg is longer than the other, they confirmed.
yeah, so it could just be that you have some pelvic obliquity, and that could be causing all sorts of things up the chain.
It is pretty dramatic, though, to get that. Like, I've seen this type of aggravation from a cervical adjustment, but not often from a lumbar adjustment.
But I just think it's just biomechanics, right? So if you have, you know, and I know this particular patient, I know that she doesn't want her name said, so I won't say it, but she had a lot of hip issues, a lot of hip dysfunction, right? So it could be that she has some pelvic issues there that are causing that. I would probably mostly be focused on soft tissue for that particular case.
Mm-hmm.
But then if you change the biomechanics in the low back, that's going to just affect everything up the chain, and that can cause increased tension in the neck. And so, yeah, I would just be working on both. And I wouldn't shy away from the neck just because you have eye issues. I would actually encourage you to do more on the neck if you have eye issues, because it can actually help with eye issues in many cases. So,
I
yeah,
just wanted to touch on the fear piece too. Yeah, that sense of being afraid, right, of going back. And I can imagine that after having this adjustment and feeling distressed getting off the table, and then finding your provider has already moved on to another room and isn't there to reassure you, can be really activating as well, and overwhelming. So there's that piece to consider is, how was that received? If something goes wrong in a treatment, did you feel cared for? Did the person stop to kind of support you? Sometimes if we have a provider that, was busy or wasn't able to, um, you know, acknowledge what had happened, that can actually create more fear, and that fear then creates tension in the body, creates more holdings, and can actually flare your symptoms more. So there are these underlying pieces to think about, in addition to the biomechanics. Is, how stressed were you when you left there, right? Did you feel that somebody was able to support you and say, hey, oh, it's just a little flare, like come back and we'll be able to help bring that down? Or were you feeling really stressed and overwhelmed, like they did something wrong, like you said, misstep? So just thinking of those subtleties as well, because they make a huge difference in how our body responds to, a flare in our symptoms, or an adjustment that didn't go as we had expected. So if you can consider whether some of those factors are happening as well, that can bring down how overwhelmed you feel, right? Bring down that fear response and make it more likely that you'll feel safe to go back and try again. So, for now, if you are flared up, it might be that focus, like Dr. Kam was saying, on gentle soft tissue work, or the TENS machine that can just sort of help support muscle flares. But it does also matter how you feel about what happened. I have a number of clients who can be so gripped by how fearful they are about what happened that they struggle to recover, right? That muscle tension gets tighter and tighter because they're fearful about what could happen next. So just thinking about that as a potential part of your picture as well.
Yeah, and they say they're going to speak up next time as well, because they do believe that they would have fix the adjustment, or not necessarily fix the adjustment, but would have followed through if they would have spoken up in the moment.
Yeah.
So they say, definitely next time we'll speak up, and the
Yeah.
depression back also due to the fear. So need to deal with that. So I think those words really, really were helpful.
Right, and how would that have felt, right, if that provider came back in and said, "Oh gosh, okay, that happens sometimes," right? Flares do happen sometimes when we're adjusting, right? It's part of the consent when you go to get any type of manual therapy. Let's support you to get through this, right? If you felt validated and supported and like you were going to be cared for and that was going to pass quickly, versus leaving with uncertainty and feeling that your provider left the room, that's going to make a huge difference in how your body responds and how that symptom flare ends up going.
Mhm.
Or
That's so
healing.
fun. Great. Thank you. And they say thank you very much. Very helpful. All right. Let's go back to live questions.
Good morning.
Morning.
Um, what I'm asking about today, and I won't go into a lot of history. You can ask me about history just to, so it doesn't get long. What I'm trying to do to pretty much get rid of um, possibly arthritis pain, but it seems to be my whole body. What I've been doing is trying to get onto CBDs instead of ibuprofen. Um, and I just need so I just don't know what's typical. Like I take a let's see, a 25 mg CBD in the morning, and it does take the edge off. But I do find that I don't know how soon again to take one, or I've been doing it for 2 weeks and kind of, seeing what works. But I find that, if I take one at 8 in the morning, um, then I'm still not, feeling all better by 10 o'clock when I have to go out and do things. So I would take a dose of ibuprofen. And then for most of the rest of the day, I'd be okay. I did try the first time I took it, I tried taking it before I went to bed, and my mouth was really dry, and I woke up in the morning and my whole eyes and even the bridge of my nose was all swollen. So I did read somewhere that it could have affected that. So I haven't taken any at night. So I was just wondering, how long do they typically last? I mean, any kind of typical advice you can give me instead of me experimenting.
So if we understand you correctly, you're asking if you can replace the use of NSAIDs, which is the ibuprofen, the class that ibuprofen belongs to, which has a fairly fast onset. Usually people will say it works within 30 to 60 minutes in terms of reducing pain.
Right.
Where now you're looking at other alternatives, and you specifically mentioned CBD. Is that correct?
Yes, yes. I want to, I'm trying to help improve my diet and everything else. And I thought I should improve this situation also and get
Yes.
away from them. Yes, I'd
For
like
sure,
to.
yeah. I think there's a lot of reasons to do that. The two main ones with this class of medications is the effect on kidney function long term, and also the effect on the lining of the digestive system.
Mm,
Ibuprofen, Aleve, naproxen, these are in this family of medications. The first one actually, kind of aspirin, and we know that they do inhibit the repair of the lining of the digestive tract, and it can cause damage. It can cause ulceration if it's used long term. Now, there are some people that use these medications long term, months and years, and they don't have any impact on your gut. But generally, the stronger the medication, like for example, a naproxen, a naproxen is the one name that you might be familiar with, is stronger, and so it's often given with medications that actually help protect the lining of the stomach, like acid blocking medications, which have a whole bunch of issues in their own right. But I think you're wise to start thinking about looking at other alternatives. I can just share with you, based on my clinical experience, CBD does help with pain, but it does it in a very different way than something like an ibuprofen. It's not going to work in the same acute way, like I'm going to use it before I go out. I think it's one of those things that people are using to decrease pain overnight. They're using it to help decrease inflammation. And you're going to have to kind of play around with the dose with the prescribing doctor with the CBD. Sometimes in the evening, there's a little bit of a combination of THC and CBD to help if there's sleep issues. I think it's one of those things that you kind of patients will layer on first, the both of them together before then removing and reducing. The same principle applies to using natural health products, where people might use something like a turmeric, a ginger, curcumin, boswellia. These are three common anti-inflammatory botanical herbs, and you implement them, and then you observe the effect on pain and inflammation, decrease the amount of medications you're taking. I think the approach can be taken the same. So there isn't a perfect formula to say this is the amount of CBD you should be taking to decrease and cover off the pain, because that's very individualized.
hmm Is it one of these things where you're better off like taking it, all day and all night, or is it okay to take it, in the morning every day and or
Yeah, so I think you want to use the CBD uh, consistently to have the anti-inflammatory effect.
okay,
Uh, Generally, the body does kind of adapt to the use of CBD long term, like every day. So what that means is just it becomes less effective over time, in my experience. But that doesn't mean that it shouldn't be tried. The idea is to try to get the pain in check over the span of 2 or 3 months, and then use less and less of it, and that'll kind of maintain its potency, or use as needed, and maybe use the NSAID, the ibuprofen class of medications, also as needed. As needed is a better approach than every single day in terms of safety on the ibuprofen front, but some people do need it start with being consistent with them daily.
No, I just I don't know if I misunderstood. Would you, I mean, what have you noticed in literature and stuff about, did you say that you've noticed that if you start with the CBD and a little THC and then after a while reduce the THC, or did I misunderstand?
Yeah, so the THC is going to add a little bit of that more psychoactive effect. And
Right.
so you're going to, and that does have more of an impact on things like sleep. Some people do need to have a little bit of that THC. You can get pure CBD that lots of patients will say really helps with their pain. So there's that. Some people will say actually smoking or vaping cannabis helps with their pain because they are getting both there. So what we're talking about is just straight cannabidiol, which is CBD.
Yeah, that's what I'm trying. Okay. I got one real quick thing. I'm excited. I live in Buffalo, and I found an acupuncturist that does the needles in the muscle with the electrical stimulation. I know it's common in Canada, but I was pretty excited to find it in Buffalo. So I don't know.
Yeah, I mean that's called electrostim, and you're basically amplifying the effect of acupuncture by attaching a
Mm-hmm.
therapeutic current that runs between two or multiple points on the needles, and it can be quite helpful to address myofascial pain, which is a large proportion of neck related pain. Now, we always warn acupuncture in general can be stimulating, so start gently, and this is hopefully something that can be conveyed to the provider, and or they just generally know that this themselves. Start gently just to gauge how do you respond to acupuncture, and then they can progressively increase the stimulation, because acupuncture and then adding electrostimulation of that acupuncture is going to be something the autonomic nervous system does still have to process. So it is an autonomic stimulus in that sense.
Yeah. He started real gradual with just
Good.
progressive. Yeah, I've only been there 4 times, but I'm excited, and it's at
Good.
least we
Good.
get a little bit of what's in Canada.
I'm
Yeah.
glad you find it.
Yeah. Okay. All right. Thank you.
See you.
Thanks.
Some of it was talked about earlier, but it has to do with 70, 120 Gs of acceleration. How to get that's how much force you have to get a concussion. Like, how much of a difference does it make if you embrace for the punch or the hit or whatever, and if you don't embrace for it, doesn't take less G force if you don't see it coming, or is it just the same?
It's the same,
Yeah.
but your chances of suffering that amount of force goes down, right? So if you think about the G forces is like the brain moving inside the skull, right? So if you're bracing for it, you'd have to get hit harder in order to cause that amount of G force.
Oh, okay.
But if you're not bracing for it, a smaller hit could cause that amount of G force. So the G force is the same because you need the brain to move within the skull and have that acceleration.
Oh, gotcha.
A perfect example of this is a study that was done on cats. And this was done in like the 40s. And basically what they did is they had 2 groups, and in one of the groups they stabilized the neck so that no movement was allowed at all. And if there was no movement allowed at all, the exact quote in the article, which is kind of funny, is that concussion could not be attained even with the largest velocity possible with the pendulum. So I just picture these researchers just trying to swing this pendulum down to hit this cat in the head to try and cause a concussion injury.
Oh my gosh.
I know, brutal, right?
Yeah.
I'm just imagining that. I don't know if that's actually what happened, but like even with the maximum velocity obtainable by the pendulum, concussion could not be achieved. It's because when the neck isn't allowed to move, you hit the head. If there's no movement of the head, there's no acceleration. With no acceleration, you can't cause a concussion. So it doesn't matter how hard you get hit. It matters how much the head moves and how fast it moves. So if you are, in a boxing match or something like that, and you're bracing and you're able to really stabilize, you could take a really hard punch and have very little acceleration of the head and brain. So that is protective. But it doesn't really matter even if you're stabilizing, because the G-forces required for the concussion injury are the same. So if you think about this in terms of like moment arms, if your neck was a complete rigid, stiff object, in order to move your head, you'd have to move the whole body, right? So if your head and neck were coupled and this was a rigid structure, in order to cause a concussion, you'd have to really hit the head hard in order to move the entire body fast enough to cause the brain to accelerate and decelerate at that particular rate. It doesn't mean that it couldn't happen. It would just be difficult. Another study done on NFL players looking at video review found that it was what they call like a finite element model. So what they'll do is they'll look at these things and they'll try to play with different variables. So they tried increasing helmet padding, increasing helmet stiffness, or increasing helmet rigidity, all these different things. Nothing reduced head acceleration values as much as if they increased the stiffness value of the neck. So if you increase the stiffness of the neck, you reduce the amount of head acceleration, because now the body and everything is coupled. So the moment arm is so big that it takes a lot of force to move it quick enough to cause a concussion injury. So the number one way to reduce concussion risk is neck stiffness. But most concussions happen when people are unaware that they're about to get hit in the head, right? Like if you think
exactly.
you're a hockey player, you're looking over your shoulder, you catch the pass, boom, you get hit before you can even engage your neck. So when you look at studies that look at neck strengthening and concussion risk, it doesn't work. Because in order to have a stiff neck, because neck stiffness and neck strength are two different things, in order to have a stiff neck, you have to have a strong neck that's actively contracted prior to the impact. Because it takes the peak linear acceleration happens at between 6 and 20 milliseconds. That's when you hit your peak head acceleration. But it takes you 90 milliseconds to even start to engage and contract your neck muscles. So even by the time, like 6 to 20 milliseconds, people are like, well, if I just have a really strong neck, then it won't happen. Well, no, because if you're playing a sport, you're looking around, you're moving around. And if you're not actively contracting your neck, it's not stiff. And if you think you're going to be able to stiffen it before the acceleration peaks, you're not, because 6 to 20 milliseconds is the peak acceleration. It takes you 90 milliseconds to even start the contraction of your neck. And it takes you another 150 milliseconds to even get to half of your contractile strength. If you want to get to full strength, it's going to take you another 150 milliseconds to get to full strength. So you're talking now about you need half a second of time in order to fully engage your neck. Now, if you're an athlete and you have half a second, you're likely going to just jump out of the way rather than engage and get low. But if you're in a sport like a combat sport where you're able to, like, you're looking at, you can engage more because everything is in front of you, right? Whereas a sport where you have to turn and look, soccer, football, rugby, whatever, you're having to turn and you're not going to see, when you're turned this way, you're not going to see that guy coming. And so that's why it doesn't really matter if you're engaged or not. The amount of acceleration at the head is still the same. But if you are engaged and contracted, it's going to take more force to cause that level of acceleration.
Does it take a difference if you think the punch or the hit is coming from the left side, but it's coming from the right side and you brace for the right side? Or is it like the same if you don't like stiff enough for the left side, and if you just stay relaxed and it comes from the right side, if you get what I mean?
I don't think it really, it doesn't matter. If your your neck is stiffer, it takes more force to cause that level of acceleration. If your neck is not stiff, it's going to take less force to cause the same level of acceleration. So if you think it's coming from the right and you engage right and you're correct, that's going to be better for you than if you think it's coming right and you engage right and it comes left. You're not going to have that same level of stiffness, which means more likely to occur.
Yeah, thanks.
You're welcome.
So this is one more of a kind of an inquiry of, so a high stress person in a concussion producing rapid deceleration, an accident, will have more intense symptoms due to underlying stress. This is what they're asking.
Yeah. So think about it this way. Concussion or persistent concussion symptoms is a direct reflection of your health prior to the injury. So if you already had neck dysfunction from previous car accidents or whatever, then your neck is going to be a problem. You get a concussion, it's more likely that that neck thing exacerbates and you have persistent symptoms due to that neck dysfunction. If you already had chronic inflammation, gut issues, hormone issues, etc., poor sleep, high stress, whatever, you get a concussion, all of that's going to be exacerbated, right? So all of these systems just get exacerbated when a concussion occurs. If you are very healthy, you have really good, strong, neck, you have, good gut health, your inflammation is low, your sleep is good, the chances of you having persistent symptom is much lower. So if we look at young athletes, their risk of PCS is much lower than if we look at middle-aged people, because they're more active, they're more healthy, they have less time for that baggage to accumulate, throughout their life. But as you age and things happen and you have life stress and financial stress and kids and whatever else, all of those things are adding up on your system. And now when you get an injury, you're less likely to tolerate that additional stressor that has happened. So if you're already in a stressful state and you get a concussion, that's just going to exacerbate, right? Like the number one predictor of persistent concussion symptoms is your pre-injury mental health status. So if you have pre-existing anxiety, pre-existing depression, your chances of having persistent symptoms is massively increased over somebody who doesn't. It's because it's going to affect those things. Even if you don't have a history of mental health, after concussion within 3 years, the risk of mental health diagnosis, anxiety, depression, PTSD goes up by 2 to 3x. So even without that. So if you already had that and then you get a concussion, your chances of having persistent symptoms increases because of that underlying mental health that is going to get even worse with concussion injury. So really it matters how you came into the injury, and it generally will reflect what's driving your persistent symptoms, right? So if you already had mental health issues, getting a concussion is going to exacerbate that, and it's likely going to be one of the drivers that's preventing recovery. So that's why we address each of those components. I don't know if you guys want to add anything to that.
Yeah, I think I did a live on the predisposing factors. I'm trying to remember what it was called, but we did talk about that in one of my presentations, just around understanding and assessing your predisposing factors to developing persistent symptoms.
And
Nikki,
Melinda,
have that in your master spreadsheet.
yeah, I'm gonna look for it. The other thing is because there was a comment that kind of relates back to it as well on top, just below it, of how it can, for this person, it also triggered some childhood trauma, past abusive relationships, things like that. Could you maybe touch upon that a little bit too?
Yeah, so that's part of the predisposing factors. It's just, understanding what your trauma history looks like, for lack of a better word, is just assessing, what had happened to you leading up to that point, right? Just as the way Dr. Cam had said, what are those stressors? What is your picture like? Are you already someone who's been living with anxiety, depression? Has there been trauma in your past? If so, right, these are things that are out of your control oftentimes, but if that's part of your picture, your clinical picture, then it's likely you may experience more or heightened anxiety, depression following concussion, and you're more predisposed to developing persistent concussion symptoms. Right? So this is kind of part of our program as well, as recognizing that when it comes to developing persistent concussion symptoms, it's likely a result of pre-existing conditions or pre-existing challenges that you faced prior to your concussion. Not just from a mental health perspective, but just as Dr. Kim and I'm sure Dr. Paul has said as well, if you have pre-existing gut issues or hormone challenges, or if you had MSK issues in the past, it's likely any of these things can get flared up following a concussion. Those who recover from concussion and don't go on to develop persistent concussion symptoms are those who were less likely to have some of those predisposing factors. So I would start with reviewing that live we did. Nikki will hunt for us what the name of the live was, and go from there. And just like a self-assessment, right? Checking in, hey, was this part of my life before concussion, as a way to sort of make sense of what's happened to you since concussion. Now, if you did have a predisposing factor around, anxiety or depression, for example, that doesn't mean you can't recover. It just means
I was just going to say that.
Yeah, it doesn't mean you can't recover. It just means that you can identify that as a trigger and then start with the recovery mindset module to start developing skills to respond to how you're feeling now and what has manifested since your concussion. What it really does point to is perhaps before your concussion, you did not have the skills in place to recover from some of those stressors. A lot of people don't. Sometimes it's only when we do have an experience like a concussion that we then learn it's essential to develop those skills to respond to stressors differently, or to support anxiety, or to support depression. Sometimes it's not brought to our awareness until we experience something more significant, like a concussion.
Do you think it was the decoupling maladaptive pathways, how to use neuroplasticity to support your recovery? I don't
It's
remember.
relevant as well. It's not the one I'm thinking of, but I can do some digging as well and see if we can find the name of it.
Right.
There's one more here that would be, I think, pretty quick. I've thought about the wreck and what I could have done differently if I could have braced. What does that look like? I mean, you don't want to go too far down that rabbit hole to say, like, if I had only done this and create the, self-blame and, oh, if only this and only that. You're in this situation now, so I would try not to dwell on that too much. But I think that, yeah, if you did see it coming and were able to brace, and you would reduce the chances of concussion injury happening potentially. Because let's say you brace and you push your head against a headrest, it doesn't matter, because when you get hit at enough force, the brain is sitting at a standstill inside the brain. Let's say you're rear-ended and you look in your rear view and you see something coming and you brace and you jam your head into the headrest so that you're nice and solid. And your brain is sitting still right now, and all of a sudden, boom, it gets hit, and your car accelerates at, 60 Gs forward. Guess what? The brain is moving backwards. So in some cases, possibly. In other cases, it wouldn't really matter, depending on how much force was sustained. Now, if it was more like a light hit, but there was a lot of whipping action because you weren't braced, well, maybe bracing would have potentially helped, but it also could have caused increased neck strain and other things. And so it's really hard to play that game.
Can you elaborate a little bit as to then why drunk drivers typically are the ones who walk away with less harm versus those who they hit?
Yeah, I mean, there's theories on that. One is that they're loose and flailing around and they don't have that same kind of rigidity, which may cause increased injuries in some cases. There's also, theories around like dehydration and other factors that may, play a role.
I mean,
Not
I think that is that actually a true fact, though. I think we kind of, it's the unfortunate, situation that we hear that a drunk driver unfortunately hurts somebody and they are, less worse off than the actual injured person. But I've seen alcohol being a huge amplifier of PCS in my practice. So I'm not sure even about that data. I think it's just like these are based on anecdotes that we kind of probably pull together.
Yeah, and maybe it's that emotional component, because if a drunk driver causes a fatal accident but they're fine,
exactly.
It gets reported in the news, and then maybe we assume it happens more than it does. I don't know what the actual data is on it. So I don't know if that's actually a fact or not. But yeah, I've heard that idea expressed before.
And also I guess the one just practical aspect is that they're often most people that are drunk driving, I would assume they're not like, blackout drunk. They're like, they still have some coherence, and they're the ones doing the hitting instead of getting hit. So usually it's somebody that's not expecting getting hit. So it kind of goes back full stories. Like they lose control and they hit somebody from behind, and that person is not expecting it, gets the whiplash, and the whole bracing conversation, I think that makes a little bit more physiological sense comes in. That's probably most likely what's happened, where they're not the ones being surprised, so to speak.
A research paper for someone in school. PhD.
Yeah.
Great questions. Thanks so much, guys.
Thanks again. Bye, everyone.
See ya.
Bye.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit. And don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.